Thank you very much indeed. I did say any questions, and there weren't any, but I have about 5. I wonder, first of all, if we could just do a bit of a sort of profiling exercise here. I wonder if you could raise your hand if you are a publisher, a librarian, consultant. Brilliant. Anybody else? Yes, okay, a technical supplier or what have you. Okay, that's the overall profiling. Coming a little bit down now more to the subject at hand, I wonder if you could raise your hand if before this session you'd heard of Research for Life. What about Hinari? Great. And final question, could you raise your hand if you are a publisher or other organisation who you know is currently a partner within Research for Life or Hinari? Okay, so that's about sort of 15 or 20%. That gives me a bit of an idea, apart from people who've just walked in, who I will not ask again, of where we stand. So what we're planning to do this session is for the three of us to give very brief, sort of 10 to 15 minutes quick summaries of what we're doing in this area, so that the second half of the proceedings can be a rather more free-form discussion looking at some of the issues that are thrown up. So I'm not going to be looking at the moment very much at issues. I'm just going to be giving you a very brief introduction to what we at Research for Life do, and apologies for those that may know some of this already. I'm Richard Gedye, by the way, Director of Outreach Programmes for STM. So Research for Life is now about 12, 13 years old, and it basically is a unique public-private initiative with partners including 4 United Nations programmes, plus nearly 200 publishers of scientific and medical content, a couple of American universities, libraries, Yale and Cornell, and a number of technical partners like Microsoft and Sweats, ProQuest and so on, who provide us with some technical services as well. And the basic goal we had when we got going is to try to do something to redress that imbalance between the amount of knowledge and scientific research information that's available to the wealthy Northern Hemisphere and the much less wealthy Southern Hemisphere or developing countries, who by and large are not in a position to afford the access that comes so relatively easily to those of us in the North. So basically, what we have been doing over the last 12 or so years is to make available at an affordable price a huge amount of scientific research content. It's now over 40,000 journal subscriptions and online books that are made available. I said at an affordable price. In fact, actually, for the 77 of the world's poorest countries, they get completely free access to the journal and book content that we provide. And then institutions in a further 39 countries that aren't quite so poor in terms of GNI per capita pay $1,000 a year for a subscription to the content, which, whilst not free, does actually come to a discount of over 99.9%. Eligible institutions, basically not-for-profit organisations in these countries, particularly universities, research institutes, hospitals, government ministries and so on and so forth. Any institution, not-for-profit institution whose staff or faculty could get positive benefit from access to the content that we as publishers provide. There are 4 programmes within Research for Life. They're subject-based programmes. The oldest and largest is the Hinari programme, which makes available biomedical content to beneficiary recipients. It's conducted in association with the World Health Organization with support from Yale University Library. Then there's Agora, which does the same thing for agriculture in conjunction with the Food and Agriculture Organization of the UN and the library at Cornell. Environmental science, ORI, in conjunction with the United Nations Environment Programme and Yale University Library, and the baby of the pack has only been with us now for 2 or 3 years, ARDI, which takes content in the physical sciences, engineering and technology, and has an emphasis on making content available to encourage innovation. Patent offices in particular are one of the recipient organisations there, and that's done in conjunction with WIPO. Now, as I say, the Research for Life enterprise has now been going for some 12 or 13 years, and it occurred to us a couple of years ago that it really was now time to actually start looking at whether there are ways in which we could assess, after all this effort on our part, what sort of impacts the programmes were having. One of the things we did a couple of years ago was to outreach to beneficiary researchers and physicians in the form of a competition where we said, tell us a little bit about how having access to the Research for Life content has positively benefited yourself and your work, your community, your country, and so on. We had about 50 entries, and of those, about a dozen we worked up into this booklet, Making a Difference. And making a difference is what we found from the competition entries is definitely something that the programmes were having. For example, a doctor in Ethiopia was able to treat a patient with a rare and serious condition that otherwise would not have been possible. A researcher in Burkina Faso was much more able to perform informed scientific writing and produce focused research before access to Research for Life. He'd had all his proposed papers for publication rejected because the youngest article was over 10 years old, because that was all he had access to. He also found, once he was able to get access to Research for Life, and in particular Agora, that a lot of the research that he'd been doing had already been done. So it really did make a huge difference to his ability to be an effective researcher. Others who benefited, a Nepalese paediatrician who saved a lot of children's lives as a result, a physician who similarly has been able to improve the lives of HIV-infected children in Zambia. At the policy-making level, a Sudanese policy-maker was able to introduce an evidence-based policy development designed to improve the people's health. And a midwife, once again, saved an awful lot of lives in Zimbabwe. Finally, an Ethiopian physiotherapist has been able to find much better ways to not only to treat his patients, but to teach his students. So indeed, these are just some examples of the people who, as a result of the generous and dedicated and motivated efforts of all the partners involved, have been able to make a difference to their community. If you want to actually look at it, that's the URL. If you want a printed copy, there are about 80% too few printed copies on the table there for everybody to have one, but if you are first and want to take one away, please feel free to do so. If you don't, drop me a line. I'll be happy to oblige. Now, producing these case studies is fine. We did start to think, well, is there any other way we can get a broader look at what sort of impact the programmes have been having? We considered doing some bibliometric studies, but in the end we were forced to conclude that there were so many non-relevant potential variables that it would be very difficult to do a bibliometric study that could nail down the specific influence of our programmes. But we did really want to do something that was wider than individual case studies, and so on the basis that the plural of anecdote is data, we decided that we would conduct a survey, which we did earlier this year through the intermediaryship of an independent consultancy, Information Power, who put up a survey on the web and invited developing country researchers and physicians and other users to respond. We had just over 1,000 respondents. This is not yet published. We're still sort of looking through the draft report and considering everything that's in it and correcting the spelling mistakes and this sort of thing. But just a couple of screenshots here to show the sort of things that we were discovering. We first of all asked researchers what sort of impact having access to research via Hinari has had on them, and we can see things here about improvement of improving their writing skills, they could deliver more effective training, they were able to do things that enhance the quality of life of people in their country, they weren't unknowingly redoing existing research, success in getting their own research papers published, and so on and so forth. A lot of positive benefits that we discovered here. And we asked a similar question to physicians, and the list that you can see here, there's a lot of emphasis on developing better medical practice that's enhanced the quality of life of patients, has saved lives, made the treatments more effective, and so on and so forth. So a lot of positive benefit has actually come about as a result of this. All of this so far has been looking at the impact on the work of individual researchers. It's also very true that a lot of the positive benefits of research for life have actually only come about because of the intermediaryship of librarians in the countries and in the institutions concerned, who have been crucial in so many cases in helping to develop a sensible infrastructure for the conducting of research and the training of people in information literacy and so on and so forth. So this year we ran another competition asking librarians to tell us about how they've been taking advantage of the availability of the Research for Life content. This isn't published yet. It's available on the web at that URL. It's not yet printed, but it is going to be printed, and once again be happy to supply copies. One of the things I'd say about both of these things, and this is my last slide, that we do have for anybody who is a Research for Life partner, we have copies of both of these which you're welcome to ask us for in bulk if you want to distribute them to other stakeholders in your organisation, journal editors, authors, internal staff, to show to them the benefit that is accruing in the developing world as a result of your partnership in Research for Life and its programmes. That's it. You can contact me at that address, at that email address, and I'm now happy to hand over to our next speaker.